Sam. I'm the Director of Operations at Reach Medical. Reach Medical stands for Respectful, Equitable Access to Compassionate Healthcare. Reach Medical is a nonprofit. We're a harm reduction facility. We are an evidence-based, low-threshold prescribing facility. We have primary care and addiction medicine specialists. We offer Hep C and HIV testing and treatment. We have integrated behavioral health. We're dedicated to removing barriers and helping all individuals gain access to really good health care.
Reach Medical currently has 5,600 unique patients. Those patients span across 56 counties in New York State. I think it's fair to say that Reach Medical has easily become the safety net for rural counties that have patients who are living with opiate use disorder. MAT is a term that's being phased out for MOUD. Essentially, they mean the same thing. MAT means medication-assisted treatment. MOUD is medication for opiate use disorder. There are two medications that are proven to be life-saving and effective for persons who are living with opiate use disorder. Those medications are buprenorphine and methadone. It's our job here at Reach, and it's our mission to make buprenorphine widely available to any person that needs it without barrier and without stigma. We prescribe one of the medications that is proven time and time again to save lives. It's the medication that helps people stay alive who are living with opiate use disorder. A big part of our work is normalizing opiate use disorder as a chronic relapsing medical disorder. When you think about people who use opiates and are living and navigating opiate use disorder, you have to think about it in the same way that you think about anyone who has a medical diagnosis that requires medication treatment or medication therapy. This is no different. Suboxone keeps people alive. It's just that, it's that black and white. All of the evidence, all of the data shows time and time again that Suboxone keeps people alive, and everybody deserves to stay alive. Imagine having any medical disorder of any kind, and before you were able to access treatment for that disorder, your doctor said, I'm sorry, you have to attend 3 groups a week. You have to take a urine drug screen test every single day. You have to go to the pharmacy and feel humiliated. And then we'll see if you're allowed to access treatment. So when we talk about low barrier, that's what we mean. We remove all of the barriers. When you become a new MAT patient, you have a same-day induction. It can be either in person or via telemedicine. You meet your care team of the guardian at the front desk, to the nurse, and then to your provider who prescribes your Suboxone. Suboxone can be taken in tablet or film. You dissolve them under your tongue. A lot of times they have like a not so awesome orange flavor to them. There's different dosing for each patient, and that dosing is worked on together with you as the patient. If you're a person that is starting to feel energized or passionate about harm reduction work, the best thing you can do is educate yourself on what it means to be a harm reductionist in whatever realm you're trying to help in. So specifically to drug use, destigmatizing people who use drugs, and not only destigmatizing, but promoting the medication treatment. Stop saying things like,
oh, they're just replacing one drug with another. Stop referring to anecdotal information such as, I got clean, they should be able to too, and start referring to evidence-based narrative, which is opiate use disorder is a lifelong disorder. It deserves lifelong treatment, no matter where you are in your path. Learn the resources that are in their community. Oftentimes, harm reduction resources are working on little to no funding. They're always looking for monetary donations, clothing donations, especially in the cold months, winter, hats, boots, gloves, sleeping bags, tents, toiletries, toothbrushes, toothpaste, clean packages of underwear and socks, just helping people meet their basic needs who are on their path of drug use and recovery that's defined by them. They get to decide what they're doing with their lives. We get to be fortunate enough to be part of that. We get to be fortunate enough to be part of that. Suboxone saves lives. Be nice to people who are on Suboxone. Be nice to everybody. Reduction works. Healthcare with dignity is a human right. If you need us, call us. We're always here for you.